Hey, everybody. Welcome to another episode of Interpreting for Healthcare. It's the National Council on Interpreting in Healthcare's monthly podcast, and it is produced by the Standards and Training Committee, which I chair. The podcast is intended for everybody. You, our members, the public at large, and anyone and everyone working to promote language access and social justice. Joining us today is a very special guest, Joana Ramos. She holds a master's in social work and is an advocate and health policy consultant. She was a founding member and past president of the Washington State Coalition for Language Access, known as WASCLA. She continues in leadership roles with WASCLA as chair of the Healthcare Committee, author and trainer on language access and services, and by serving on the WASCLA team for the Language Access Advisory Committee for Washington State's Education Agency. Her language justice involvement is inspired by her multi-sector background in direct services, community organization, research, and domestic and international policy work. She has held positions in fields including healthcare, adult education, child welfare, and access to medicines. A former Portuguese medical and community interpreter, Joana was in the pilot group to earn the core CHI credential and also held Washington DSHS's medical interpreter authorization. Joana continues to be active in several health equity networks and organizations. Some highlights of her involvement in past and present initiatives include preserving the Interpreter Services Program for the Washington Medicaid Program, ensuring language access services and State Affordable Care Act implementation and at pharmacies, promoting stakeholder engagement for Washington's language testing and certification program for medical interpreters, producing multilingual consumer materials on language access rights in healthcare, advocating to establish an Office of Equity in Washington State government and with language services coordination, drafting recommendations for the Washington governor's COVID-19 emergency language access plan, and most recently, helping to inform equitable access to the Medicaid redetermination services in the public health emergency unwinding. Joana is a member of the Eligibility and Enrollment Workshop for Washington State Health and Human Services Agencies, the Language Access Research for Community Health, LARCH group, and the Community Advisory Board of the Harborview Injury Prevention and Research Center. Thanks so much for joining us today, Joana. It's really a pleasure to have you here. And I just have to say to those that may not be familiar with WASCLA, Washington State Coalition for Language Access, it is something that I wish existed in all 50 states. It is really the only meeting ground where everyone and anyone who needs to source qualified, trained, certified interpreters, reliable translation for all the needs, not just the court interpreters, not just the hospital interpreters, but everything. When there's a forest fire and people need to be evacuated, those doing the evacuating need to be able to communicate that to everybody in the community, whether it's the firemen or the forestry. The parks services need to be able to attend to drownings and other mishaps that occur when people go camping or go to our beautiful state parks. And there was no place before WASCLA where people could go and say, how do I do this? Where do I find what I need and get reliable quality information? So kudos, Joana, and welcome. We're really happy to have you with us today.
Well, thank you so much, Eliana. I really appreciate this opportunity to talk about some of the things that I do and the organization WASCLA does. And it's rare that we get a chance to reflect on the work that we're doing. And it's really important for us to make connections and to build our collaborations, because we'll know that there's no need for us anymore when all the communication needs are automatic, are a given and of high quality. So we have a lot of our work cut out for you. And I just wanted to clarify that WASCLA is an education and advocacy organization, not a direct service group. That said, we do offer some services to the public. And one of them, as you mentioned, we have an interpreter and translator directory on our website. It's a free public service. We also hold bi-monthly language access update calls, open calls where we discuss topics, hear from speakers doing work both locally and nationally, and talk about issues, concerns, etc. We have a newsletter, a bi-monthly newsletter on alternate months, and pre-pandemic, we held annual summits, switching each year from a different side of the state to make it more accessible for folks. And since then, we have started having periodic webinars, and we'll be looking to be for more offerings in the fall, but I'm not ready to share details yet. So thanks again for having me.
Well, I guess we'll have to stay tuned to find out more
Yeah.
about those upcoming events. In that case, I'm going to go straight to our first question, which is looking back in your role and your many roles involved in language access here in the state of Washington, what are you most proud of?
Okay. Well, I have thought about that. Well, one of the things that I personally was involved in was assuring that there was language access for the implementation of the Affordable Care Act. And the plan was for there to be insurance plans available to people starting in 2013, either through the federal government's healthcare.gov, or states had the option to create their own, what's called a marketplace. Washington was a state that chose to go do the marketplace option to run it themselves. And okay, so as things were rolling to get that, and a new agency was being created to handle it and so on, they hired a large national consulting firm to help them with the plan for how this would roll out. And before we had even read the plan in its entirety, WASCLA was contacted by a Pan-Asian community or human services organization who said, "Did you see this plan? We need to read this," because the so-called experts had told the state that all they needed to do was provide services in English and Spanish. And that's important. However, because of the people who get that official designation of having limited English proficiency, which we do not like to use, but when it's necessary because it's deficiency based, but when we're referring to official policies, we use it. And we have over 200 different languages and dialects are spoken in Washington. So what I was going to say, of the group of people who have the name, the descriptive limited English proficient, half of them are Spanish speakers. That is true, but we have, and there's wide geographic variation across the state. So that leaves out, that means the other 50%, of course, are not Spanish speakers and speak very, very diverse languages, again, with very high geographic distribution. And Washington has always been, for years, like in the top 5 states for refugee resettlement, and has been proud of that fact too. So we needed to make a plan. So different advocacy groups started working on this. We were fortunate too, because we had a lot of people who had gotten together to advocate for the Affordable Care Act itself. So we had that that network. And WASCLA had its origins from advocates in legal services agencies. So we had that too, to bring in, what are the requirements? And so we mobilized, we went to many meetings, we wrote letters, we appealed to the agency that was going to be in charge and the insurance commissioner and so on, and brought together a lot of folks. And it was really, there was a huge need for education, because the people who were going to run the show had it wasn't even on their radar screen about language access. And we issued in December of 2012, and I still remember this, it was a blood, sweat, and tears task to get it done in time, a report on the language access in implementation of the Affordable Care Act. And it was a joint effort between WASCLA and Northwest Health Law Advocates. And we needed the data to show them what the real population needs were. And I went to the Migration Policy Institute because I was familiar with their reporting and their deep involvement on integration, into immigrant integration, population needs, et cetera. And they were able to make a custom data set for us before that year's American Community Survey info was available, because the census is not real helpful, because at that time they only reported on 39 languages, and that wasn't even, done on a regular basis, and many of them were not relevant to Washington's population. So we said, hey, take a look here. And we actually were able to convince this new agency and the other parties that, they needed to do it differently. And they developed a language access plan for the program. And they set up a new committee called the Health Equity Technical Advisory Committee. And that continues to that day. And that shows, it's a good illustration of the power of collaborations. Now, is everything perfect? No. And originally, when the agency started putting out its outreach materials, they had not conducted a community review, and we started hearing in our networks about, what some of these things say is very troubling, and it actually made the news, and they had to redo it and hopefully learn some lessons from that, of some, very inappropriate, like street language that had been used in some of the translations. And maybe this Google Translate wasn't such a thing back then, but still, it was a big education and advocacy campaign. And so, and they have this call center, they have some bilingual staff, and they have, contracts for telephonic. So
it's not easy to get a
No.
government agency to shift in how it's going to roll out something that it already has planned. That is real. That's a real David and Goliath story. So congratulations on getting them to take on the recommendations and change how they were doing things. And like you said, nothing is perfect, but all we can do is keep moving towards the goal. And that's why I think WASCLA is so valuable, because it's that cross collaboration. When you start getting the same message, when the higher ups, when the people with the purse strings or the top administrative positions that decide on budgets and that decide on what programs to support, hear the same message coming from a variety of participants, people that are enrolled, people that get paid to run programs, people that make use of the programs, whether you hear it from the doctor or whether you hear it from the lawyer or whether you hear it from the fireman or the teacher, if they're all saying the same thing, it really does strengthen the changes, the needed changes, so that we have a different outcome and we have a better outcome for the people that need the services. So I really hope that we can plant the seed in those places where there is not a how to encapsulate everything that WASCLA is like this giant octopus that reaches into all these different types of work,
Well,
job categories and areas of responsibility, and comes back to the center with the same message of how to create a viable language access plan,
yeah,
select a reliable interpreter or translator, and how to create messages that can easily be shared, right? We don't want to translate someone's thesis in mathematics or biochemistry at that level. We want to have a register that is easily understood by the greatest number of people. So being open to hearing suggestions of how to do this better and share it amongst all the people that need to communicate with speakers of languages other than English, especially when it impacts their health or their safety, is just something that you cannot get done in any other way. We need that collaboration across industry, across specialization, across job description in order to have a coherent and cohesive plan going forward. So cheers.
Well, thank you.
WASCLA.
And this is a good point to add a couple of other things that, and I know you're going to ask about challenges. WASCLA is multidisciplinary, and that's both a plus and a minus for us, because it's really a lot more difficult to make an organization like this sustainable, that's not limited to one service sector. We've gotten funding for projects, and the demand for our services is so great. We really are, we're working to so we can get staffing, but there has not been until really recently much available for social justice work. I mean, that's an ongoing issue. And I also say about the translation part, some of you may know we have I Speak cards and Know Your Rights flyers for consumers in the 30 most spoken languages in Washington of people with limited English proficiency. And we were so careful. We wrote our materials at about a 4th grade reading level. We had a translation protocol. And when we got them back and had our community review, some of the reviewers told us, oh no, some of these translators who were proficient translators, they went ahead and converted the text to a much, much higher reading level. So we even had that problem too, and had to go and, before they could be released, to get it fixed. So it shows how, you have to be so careful. And there was no discussion, no check-in about, is this okay as we do this? And carefully vetted the translation services too. So, yeah.
So right now, in the present moment, what are the biggest challenges for WASCLA, or bigger than WASCLA, just for language access in general, or social justice even?
Oh, well,
as big, as broad as you want.
Well, that's a big topic, and I'll try to condense what I'm going to say. The challenges that we have were not created overnight, and so they are not going to be fixed overnight. Policy work is difficult. One of the things that WASCLA does is not only seeks to have a place at the table, sometimes we have to create that table ourselves and call out issues and concerns and harms. And so as we are not direct service, we really rely on our connections with many different direct service and community-based organizations. And we do get contacts from the public too, talking about problems, lack of interpreters. And I could tell you many anecdotes about that, and I use them in training. But the overarching thing is a combination, the commitment to providing what we call meaningful language access that really works for people, and the understanding of what that actually involves, what needs to be done. And it's not easy. It encompasses all the aspects from the service delivery, on the one-to-one basis with individuals, to it's not limited just to interpreting or translation. It's about what happens when the person interacts with whatever service they need to do, and having this commitment to equitable access. It's like I said, it's not just in WASCLA was founded when there was an opportunity to from the U.S. Department of Justice to offer some services they identified the needs of victims of domestic violence and their children outside of the courtroom. In the courtroom, they were, not always, but there's supposed to be an interpreter. And then what about that? So it's like outside of the exam room, how are people faring? Can they get the information they need? Can they get services they need? How are they being treated? What's their experience when they walk in the door of the facility? And it's an ongoing thing. And there's so often now we have some exemplary services too. And I know that you're all probably aware of them, like at Harborview Medical Center, where, but that's where Eliana used to work. But that's because of the commitment from the top that we are going to serve everybody. And when we found that it's even really hard to learn what services are even available. Sometimes it's because there's no requirement that it be reported. And I was part of a group that did a survey of web-based information from Washington's hospitals that has been published, and it was published in 2019. So it's actually helpful now as a benchmark pre and post pandemic to see what has changed or not, but found that about 90% of the hospitals did not have any visible information about their language services and how to access them, like on the homepage. And some of them were hospitals that we knew have language services, but it required navigation through multiple pages in English before you could even find out. And we have to ask, what is that all about? It's such a core thing. And today, more and more people are using mobile devices as well as the internet. We of course still have digital divides, but it's like that really basic thing. And then there's the reporting, understanding, the aims of, let's say, public programs for improving the health of population, the health and well-being, which is an investment for all of us. And there are real gaps in how any type of information about language services are reported. And in this, well, it's very pervasive, but often the agencies will say, well, if somebody reports when they enroll that they need language services, then we'll mark that down in the language category, but we don't find out whether they actually get language services. And so, and like I said, that's the number of people officially who are counted as having limited English proficiency in the census is close to 600,000 people over the age of 6 in Washington. But we know that that's a way undercount, because first of all, the census only asks, how well do you speak English? And you get to pick from this, multiple choice, not about understanding, reading, writing. And then there's many reasons that there has always been an undercount among immigrant-based individuals in even replying to the census. And so we know that the needs are far greater than that. So it's really a challenge, but often it seems that people in some managerial positions, they've never had any training on the topic and they don't understand it. And so it's really, making genuine inroads in health equity work and considering language access as a routine part of healthcare, not an outlier. That's among the largest challenges we continue to face.
I remember coming across a study done by firefighters in
Mm.
Northern California, trying to understand why, when they told people to evacuate,
Oh, yes.
people didn't
Yeah.
evacuate.
Mhm.
Even amongst English speakers, in
Yeah.
times of emergency or
Mm.
distress, the ability to
Mhm.
understand spoken language or to read written language drops by several grade levels
Mhm.
when people are under duress.
Yeah.
So they realize that even for their English speaking,
Mhm.
born in the USA folks that they were trying to get out of harm's way, that they had to have shorter, more direct, and at a earlier grade level in terms of
Mhm.
readability, fifth,
Mhm.
sixth
That
grade.
that's
And
really
and that's just
critical.
for people who speak
Speak
English already.
English. Yeah,
So I
well,
use that as an example
example.
when I speak to folks saying, what do you think the person who has a preference, who has a language other than English as their first language, may speak several languages, but may not speak English well? How much stress do you think they're under when they come into the emergency room, when they're standing in the courtroom in front of a judge, or in all of these other situations? Whatever proficiency they claim to have had is going to be diminished in
Mhm.
some way
And
just by the stress that they're
of it.
under.
And that also gets to the attitude problems grounded in implicit bias. I mean, when I worked as an interpreter, I can remember a time one of the, reception people saying to me, well, what does she need an interpreter for? She talked to me in English. And I said, well, first of all, that was a request made by the provider. I wasn't going to get into a debate with her. And I said, communicating, exchanging pleasantries for basic needs, that's a whole different thing than a crisis situation, a healthcare situation, and so on. And that was when you bring up about the emergency services. That's what we learned in 2014 and 2015. Our state had no plan for communicating with it. That's when we had very bad wildfire season in central Washington. No plan whatsoever for communicating in languages other than English. And that led to another area of WASCLA's involvement, because we consider health as in well-being. So it encompasses a lot of things, which led to legislation requiring communication requirements for the counties in emergencies. That's been in place for about 5 years, and now it's time to find out how it's working. So
So looking ahead,
okay.
what are you excited about? What would you love to see happen?
Uh,
You can paint it as rosy as you wish, or you can talk about what's worrying you.
okay.
Looking forward, what's on your
Uh,
mind?
Wow, that's a tall order too. There's an awful lot. I think we're at a good point now, a better point than we were before, but of course, motivated through tragedies and suffering that a lot of our major entities and health systems, for example, started having equity initiatives after um, George Floyd was killed, and they woke up and said, well, maybe if it wasn't something that they racial justice was something maybe had not been thought about. I mean, they I guess over the years some folks would learn what was okay and not okay to say in public, but that all kind of got, and but we're in very, very challenging times politically, And that worries me a great deal about progress. And that's why it's so important to keep moving forward with everyone who has the commitment that all people have the right to live and thrive in our state, in our nation. And and using a whole lot of our own structural means to call out problems and look for solutions. But it's getting complicated, and I have my opinions about how our healthcare system operates, and it seems like I happen to subscribe to a number of these publications from the industry side. I don't like to call we've let healthcare as an industry in this country. Some people, that could mean different things, but that it's just social determinants of health. We have an app for that, or we could use artificial intelligence for communication. Who needs qualified bilingual staff? Who needs interpreters? And I worry that those who are looking for a quick fix will jump on that and not understand. And it's very troubling. I know it's happened in different states around the country and in our state too, that there's many people who have been interpreters or are interpreters who have work mostly as freelancers. Some have started a little bit bigger, small businesses embedded in communities who know the community needs, and it's not just language, but the cultural needs, and they are struggling to be able to continue to do this work because it seems like there's a quick fix from all the types of remote services. And there definitely is, it's important to have the remote communication services because we can't cover all, and especially in a state like ours, we can't cover all languages and at all times, but it has to be part of the service mix, not the one and only thing. And there's a lot of resistance, and we see that language services need to be a regular, ordinary part of operating budgets, not an outlier. And I know the history, that this there was resistance in the medical official resistance in the physician sector of incorporating language services when the executive order 13166 was enacted in 2000. That has changed, but a lot of the mentalities have not changed, and I'm hopeful that a new generation in the provider world is going to really make a difference because it's a much more diverse group than used to be. The province of not just the white men in the executive suites and so on. So it's and not to stereotype anybody, because there obviously are many excellent exceptions of people who are totally committed, and it's not linked to anybody's individual demographics. But that's what I'm hoping, that we will really see what makes a difference and listen to diverse voices, not have a one-size-fits-all approach, and to support the growth of groups like WASCLA, which you said, it could be a benefit all around the country, because sometimes, it's necessary to have watchdogs and
Oh, yes.
and file complaints. And that's another thing. There's a real big discrepancy between complaints that are filed by folks who are deaf and hard of hearing and for spoken language services. And it's very structural. And we've heard this from the federal agencies, and said, well, it's really intimidating to think about filing a complaint. Many people would never do that. And the climate of fear that particularly was enhanced in the last administration over, persecution of immigrants. People are afraid. People have been afraid to, identify their language needs. And that's why they, we may not get accounts from the census or from a hospital enrollment or whatever, because, for example, a lot of people don't know that not only they have the right to language services, but that language services must be provided at no cost and at all the points of entry during all hours of operation. So we have our work cut out for us.
We definitely do. There's one thing I want to circle back to in terms of reassurance, and I'll make a point on that. And that was when I did a podcast earlier in this series with Dr. Carrie Jackson, who just retired, but was the head of international medicine at Harborview, which encompassed multiple clinics that served lots of people whose first language was something other than English. And Dr. Eric Hart from the East Coast, who was a pioneer and one of the founders of the NCIHC. And they both said that they are really encouraged that the people that they have been mentoring most recently get it, in the sense that they understand that having an interpreter is the best way to get the information that they need from their patient who may not speak English or may not speak it well, and that there was no convincing that needed to be done. So chalk one up for us. Now we have to switch and focus on administrators and people who run the hospitals and people who contract with the video remote interpreting language service providers, because there's not enough training for those people in the C-suite, nor are the companies that sell the services investing as much as I think they should in training the users of the equipment, which is always three parties, right? It's the patient, the interpreter, and the allied healthcare worker or doctor or nurse. And I think that we could be doing a better job in terms of educating people who interact with the device, which call up interpreters, so that they know how to partner with an interpreter and know why it matters. It's not just the new residents who get it, but it's everybody else that's involved in the mix that we need to educate.
That's a good point. If we have another minute, I'm just going to say an example was after the pandemic started, and we were trying to figure out what kind of convenings can we offer. I decided that we needed to do something about telehealth and language access, because there'd never been a formal discussion in Washington outside of like individual facilities. So we went to the National Telehealth Resource Center, which they have a they're regional, and there's also a national technical assistance center to, and I think, I know that you attended those webinars, and they told us, I mean, it was just the first time they had ever heard of, one of them told me that of language access. Is that, I've been doing this for like 20 years and I never heard of what is this language access. And we thought that they were going to tell us which of these telehealth platforms had like a channel for including interpretation, whether it be sign language or spoken languages. But that's not what happened. And so it's time to revisit that. So we elevated that issue, but basically those two sectors have existed or grew up totally the silo effect, no interaction. And it's just another example of language access being seen as an outlier. And of course, these are federally funded entities too. So, it's ironic. So it was an educational thing, and then they became aware of us. And I hope, we're it's a challenge to keep up with everything that's going on, but it's important to talk about it. So
I guess for the future, we've got to knock down some silos and get everybody in that chain of stakeholders, providers, users of service, subject matter experts, providers of service, employers, healthcare systems, like everyone that is outside the actual triad of patient, provider, and interpreter, to see each other is the first step. And then we can all agree on best practice, especially if it has been well established for many years in other sectors that have never before been paid attention to. It's our time to stand up and knock down those silo walls and get ourselves in that kumbaya, join hands moment, and at least have the same thought at the same time about how to proceed. It's a big ask.
It's a big ask as we're
up for it.
Our dynamics. Yeah.
We are tired of making that argument that Title VI has been a law since 1964. Stop pretending you don't know what it is and join the conversation. It's only by joining the conversation that we can make changes that all voices can agree on and partner with. And I think that's what we can do to move forward. And thank you so much for being an organizer, being the center where all those spokes on the wheel come together to have the exactly what we've been talking about, the kinds of conversations of how do you do this? Why do you do this? How did you set it up? What's the best way? What's the wrong way? What's the right way? Shared amongst people from diverse backgrounds and professional areas of life. And with that, I thank you so much for being our guest.
You are
Tell everyone out there to listen to these podcasts. We have one coming out every month. Thank you so much for joining.
Thanks so much for this opportunity, Eliana. Bye.
Bye-bye. Ciao, ciao, everybody.
Say mais.